Welcome back. We are still dealing with the issue of infertility and how it affects our world of today. Recently, we've had a number of clients come in complaining about how infertility is affecting their marriage. With me, I have the honor of presenting to you Dr. Osazua Henry. Thank you, sir, for coming.
Thank you very much.
Welcome. I also have, as usual, my dear husband, Dr. Maxwell Odiegu. Sweetie.
Thank you.
Okay. This issue is, it's affecting everybody. If your neighbor doesn't suffer it, your church member, your sister, your brother. What are the possible causes of infertility?
Infertility, one, let me start by saying that it's a very important topic to discuss.
Yes.
A reason is because in our environment, we like motherhood, we treasure motherhood. We also take children as something that it has to your worth. So those that have delays or are childless, there's some degree of stigmatization.
Yeah.
So that's why it's a very important topic to discuss. The causes, we can break down the causes because we like to look at infertility as a problem of the couple. It's better viewed as the man and the woman when they come together.
Yeah.
So we have causes that can arise from the man or the woman.
Okay.
And at times, their coming together can also create an issue. So let me just discuss the woman. For the woman, what we're worried about are infections that can affect the tubes.
Okay.
And these infections, a lot of times, they occur at a time years before the woman gets married. So a lot of times, she's lost track of
without
the
knowing.
triggers. Yes. So the setting that can easily cause infection is one, abortion. The one we refer to as criminal abortion.
Abortion.
Criminal, often done in places that are unhygienic. There are improper precautions. So infection is often a complication.
Okay.
And because they are trying to hide it, they are also likely to go to all these drug outlets to buy inferior drugs. So that's one. Then another setting is what we refer to as pelvic infection, pelvic inflammatory disease.
PID.
That one is common with promiscuity. Because the pathogens that often cause it, they tend to move among people that are promiscuous.
Wow.
So that can also affect the tubes. Then the other setting is people that deliver in unhygienic environments can have infection after childbirth.
Okay.
So you see that in our environment, we have more of these kind of issues that can damage the tubes for the woman.
Okay.
So in my practice, a good number of clients, they have tubal issues. But there are other things that can cause infertility in a woman. Another common group is women that don't ovulate often.
Okay.
People that don't see their period often, they tend to fall into that category.
Okay.
So those ones, if you look at fertility, human fertility is not very efficient. Even if a woman ovulates every month, the chance of getting pregnant in a year probably about 6 days out of 365.
Wow.
That's about a week out of 52 weeks.
Wow, that's
So
a lot.
it's not very efficient. So if a woman is not ovulating regularly,
it's even more difficult.
It crashes the probability. So that's another one. Then there are also other issues that can arise, like in our environment, we also have issues with fibroid. Fibroid can become so big, distorting the uterus, can also block the tubes, can create an unhealthy environment for the baby to implant. So that's another common subgroup that we find in our practice. And at times, as a consequence of abortion as well, instrumentation, the cervix can become blocked. And when it gets blocked, the sperm will not find access into the uterus. Then we discuss our environment. People also seek traditional help when they have this kind of issues.
That's another big problem, yes.
Yes, and at times they can put caustic materials in the vagina. So at times it just blocks everywhere.
And they think that,
yes,
that's good.
Yeah, because at times those things, their initial reaction is to cause some bleeding. We always believe that bleeding is like you're removing the bad blood.
Bad blood.
So it's almost as if this one is probably a good treatment. Whereas what you are creating a setting for problems later. So I think for the women, the lesson is issues with infertility are things that can occur years before you even get married. So you have to protect your motherhood from when you are young, because it can become an issue when you are now older and you are getting married. For the men, a lot of the issues with the men, they circle around the quality of the sperm.
Okay.
And that's where a lot of the issues operate through.
Come from.
So what we're worried about is the one that the sperm is very low or it's not there.
It's not there. What does that mean, sir? What does this not there mean?
What it means is that the part of the body that produces sperm is not working.
Wow.
So you have the semen coming out, but there's no sperm inside.
So you can't have children.
You can't have children. You can't have children. You can't have children. For the men, infection also plays another role.
Okay.
Gonococcal infection is an important one. So it also damages the passages where the sperm pass through, or it can also affect the testes directly. So for men, you see that for men and women, infection is something that plays an important role in both of them.
Yes.
And here we also have ineffective treatment. They go to the pharmacist, just get any drug.
Just
yes,
give me ampiclox. Give me ampicillin.
There are other smaller causes, things like people that have torsion in the past when they were young.
Okay.
Those ones, they may never have a history of it. Only their parents will know that they had an issue and they had a surgery. So people that have had growing surgeries before, we're worried about them because may either have affected the testes or the passages where the sperm passed through may have been damaged in those prior surgeries. Some people have they have genetic issues.
Okay.
They are born with some kind of problems.
Born like that.
Yes, that affect their fertility. The good thing about fertility nowadays is that the treatment options are better. So now we don't even like to use words, terms like infertility because it's an absolute term. It means that you cannot. We prefer the subfertility. It means that you have a reduced potential, but you can get pregnant because of the treatment options, which I'm sure we'll discuss later.
Wow, that's okay. Doctor, you know, he talked about the causes of infertility in men and women. But how do you know? What are possible symptoms? How do I know that, you know, I have a problem and I should, you know, visit my doctor? What are some symptoms?
Yeah, well, are there really symptoms of infertility? From the definition, it says that when a couple is not able to achieve pregnancy after trying consistently for 12 months.
When you say trying consistently, what does that mean?
Yeah, well, for us, ideal definition of trying means at least there must be copulation or sexual intercourse 3 times in a week.
Wow, religiously like that?
Yes. The reason why it's extended to 12 months, as he said, is that the human reproductive system is highly ineffective.
Okay.
In a cycle, the chances of a couple that has been trying, even if it's every day, of getting pregnant is less than 20%.
Wow.
So
a healthy
yes,
couple.
When you assume that everything is okay. So it means that you need to try not just for 1 month or 2 months or 3 months. In 6 months, maybe like 50% of the couple will have achieved the pregnancy. It will take another 4 to 5 months. That's like 10 months, 11 months before you can have 85%.
Okay.
That's if you assume that everything is okay. So it's highly ineffective. So it is after then we can now say there's some form of problems with fertility. That is when the gynecologist may now come in and say, okay, let us investigate and find out whether there are maybe problems. So like the symptoms, doctor, we've been trying.
It's not happening.
So the gynecologist now comes in and tries to investigate. Some of these investigations, because of the way in our environment, we start with the basic investigations. Then if you do those ones and you don't see anything, you may now want to step up to, because sometimes you may want to put cost into consideration, depending on how the couples come. So it's more like a stepwise approach. You start with the basic investigations. If there's nothing there, you may need to step up again just to see if there's anything. But we should also know that we have what we call unexplained infertility.
Okay, that's another angle.
You've done all the tests, everything seems okay, but nothing seems to be happening.
Okay.
So it's more like a diagnosis of exclusion. You keep on doing tests and tests until you try to see that's within the limits of the environment where you're practicing, within the limits of what you can afford and the available equipment.
What of complaints like painful periods, heavy bleeding?
Those are entities on their own.
Okay.
Painful period, when you have it, you know, when you see a couple, you want to ask those questions.
Okay.
There may be some association. I have painful period does not mean that you're not likely to get pregnant. It may be a symptom of something, maybe like endometriosis. You know, heavy bleeding may suggest.
What is endometriosis?
Well, endometriosis it may be common here, but people don't really talk about it much. Even though some people are beginning to come out. When you have some tissues within the womb that will now end up in other, outside the womb, other
where they are not supposed to be.
Yes, and the major symptom is pain. The pain, there's so much pain during periods, and in some people it may be severe enough for you to still have pain after the periods have ended.
Wow.
So it's just a life of misery. The pain is so much that you are not able to do more. In fact, it affects the quality of your life. So for doctors, you first of all want to deal with the pain, because some of them will come even when they are not married yet. So you want to deal with the pain first before you now say, okay, when it's time for you to get pregnant, let us see how we can help you.
Can they really get pregnant? Can you get pregnant with that condition?
Yes, they can, but it's easier with assisted conception.
I see.
It's easier with assisted conception.
Okay. Okay, sir.
Yes, let me just, I wanted to just highlight something I just remembered.
Yeah.
In our environment, my patients have been seeing some, I think particularly the men, they have issues with performance, which can contribute significantly to infertility.
Yeah.
And I think they have this abnormal notion of what performance is. So when they get married, they can't meet.
Oh.
So what now happens is that they start having issues with direction.
Yeah.
So I've seen a number of them. So I think all these maybe Western movies, pornography.
Because they now have a particular standard that they think they should meet up with. And it's a bit psychogenic, if I may say. You want to now impress your wife, and in that bid is you are tensed up when it's time for you to. And some people even believe that they probably need to meet their wives every day for something to happen.